Oh, thank God.
Doctor, hey.
Howdy.
Hey. My friend here, he's crippled. He needs a wheelchair.
Well, take him downstairs, have Nancy see him. I'm actually headed towards the OR.
Wait, where is she?
We've been looking everywhere. We can't find anybody.
Take the stairs right there and take him down to the reception desk.
Okay, thank you. Does sound like that. She's right.
God, I don't know if this hospital. Real quick here.
My God, don't worry, I've been entertained with the whole ARP situation. Why is there freaking 4 SUVs pulling up? 4 black SUVs. Do you see that?
Yeah, I did.
I can see it in the reflection of the window.
I'm gonna get you.
Howdy, y'all.
Don't say that.
Dr. Knight!
How
What are you doing, Mr. Knight?
How are you, Doctor?
Katie, knock it off.
Well,
How's
how we
the
got?
day
Listen,
doing,
doctor.
Knight?
Oh my
Doctor, he wants to know while you're in there if you can make the penis a
I
vagina.
love him.
What? Excuse me? No, I would like to keep my stick.
He said he wanted a vagina.
I did not. I'm not paying for that.
Make sure you fix his brain while you're in there, okay?
Wow. You know what? That's rude.
Well, how about we take care of the bullets first, and then we can figure out what my patient would like after that.
Well, he definitely wants a vagina now.
I do not.
Okay.
Don't even know
He's
why
already
I
picked out a
invited you.
name.
I don't know why I
Right.
invited you.
Dr. Knight, I'm not gonna lie. It's like vibrates my heart when you speak.
I hope that is a good thing.
I'm calling Meg.
It's just so deep. I don't. Okay, I feel awkward.
Nothing to feel awkward about there.
I'm just gonna stand in the corner, okay?
So how long should he be out after surgery?
Well, realistically, after the procedure, it'll probably be a couple of hours before I can wake him up from the anesthesia, but we'll see how he's looking. But he is going to be quite sore afterwards, and he's definitely going to need a few days rest.
Understandable.
But we can take him back.
Yeah,
So
let's...
you hear that? No wild cocaine parties and a bunch of hookers like you normally do.
Yeah,
Okay.
no,
I don't
no
know what you're
cocaine
on
and
about.
hookers right now. Now, maybe here in a few weeks we can talk about that, but...
A few weeks? He can't have hookers for weeks?
How is he gonna live?
You gotta remember, I'm gonna be slicing into several
You
different
guys-
parts of his body to get those bullets out.
You asked
Whoa.
for people to be here,
Yeah.
so you should know this is gonna happen.
I wasn't expecting this though.
Well,
I was
Yeah.
expecting you got this. Don't worry. No, I'm getting
Oh,
size in my left
you
ear.
got
Oh, he wants a
this.
vagina in his
Yeah.
right ear.
well, we can vote on it.
What is? No.
Yeah, let's do it.
Well, Doc's gonna step in and take away the democratic process for this one, because unfortunately, the way things work in my hospital, my patient tells me what they like.
Well,
You know what? I like
If
this
you-
fucking hospital.
well, if you don't want to get a vagina, can you make his penis like this big?
Okay.
It's already that big.
Like,
And I am definitely the wrong specialty for that type of thing. He would need a plastic surgeon for those type of amputations.
I tried, Jerome. He doesn't want to do it.
You're just making it smaller then.
It's one thing you have to keep in mind is I'm a trauma surgeon. I take care of people in critical incidents when most of the time their life hangs in the balance.
We appreciate it.
Okay, sir, your voice is
You
actually
want us to
kind of
get the
hot.
fuck out? Oh, see, I told you he wants a vagina.
No, how does that turn into that? What the hell?
Because he wants to. Okay.
Dr.
Hey,
Knight,
Yep.
Oscar,
Yep.
you want to continue
Yes.
this one?
I'm good.
You
I'm good.
still work
I
for
want
me.
to keep my
how-
job.
Yeah,
how
that's
do you
what I
have to
thought.
work today?
I'm sorry. Right now you
Well,
are.
actually,
not
this is the
able to
only
work,
surgery
so
that I
Katie's taking
have. I'm
calls.
hoping to
Oh,
leave Miss Meg
she
for
is
coffee
going.
afterwards.
You are?
By the way,
It's not a
I'm
presidency.
hoping
Okay,
so.
well, just so you know, So if you kill him, then I will be owner.
Okay.
Wait,
Okay.
see?
I need to call Max. I need to call
Team
Max
meeting
right
outside.
now.
Team meeting
Kidding,
outside.
kidding.
Let's go outside, guys. Let's talk.
No, but seriously, he is the owner, and I am a manager, and we will take care of you
Co-owner.
when you get to the store.
I appreciate it, John. I promise
She doesn't
y'all I will
want. She doesn't
do
like being
everything I
called
can.
co-owner, but she is co-owner.
I promise you I'll do everything I can to make sure that he gets through this surgery with the best possible outcome, and that I can get him back to y'all as soon as possible.
Alright. Appreciate it, Doc. And if you need us to come pick up some roses for Meg, let me know. I'll come by and pick them up for you.
I appreciate that.
We're very hopeful
Yeah. Anyway.
about the surgery.
Yeah, oh, yeah,
Oh.
back to the surgery.
Also
Yeah. Yep, it's fine, guys. I'll sit here.
I mean, what else can you do?
Seriously. Be fine. You're
Probably
gonna be fine.
plan a car meet that I was gonna host in probably like 2
Oh,
days, which is
wow,
now
wow.
gonna be postponed because of all the life.
Well, no.
No?
You
I don't know.
can take your new fancy wheelchair out there. You can show
Oh my gosh, I wish I could,
off. We'll put a turbo on that thing.
but I can't. I'm too deadly with that thing, man.
But you can lock the wheelchair. You can put a seatbelt on.
And if you got any
It's
friends
not
that
that,
run a
it's
tow
just
truck,
that-
then they can help you get it out there.
I don't want to get in trouble with
I
the law,
see.
really.
Like it.
Hey, you know what? Nope, I got it. I'll call Harry. Harry's got a tow
Right.
truck. It's already done.
Realistically, I believe I can have you out of ICU before that car meet.
That's my man right there.
I
Let's
like
go.
that.
Let's get that.
Now, it's going to come with a little bit of compromise.
What? What am I losing?
The compromise would be that you're not going to be out there in the spotlight the entire time. You are going to have to take it easy.
Yeah, but he can
us.
sit.
He
He can
has
sit
us.
though.
We'll put David over
Yes.
for a day.
I got
well.
umbrellas. I got chairs. I'll
Oh
man,
yeah, I've
be
got an
fun.
umbrella. I've got a table.
So is that a fair
Go play some
compromise?
chairs. I love it. I love it, Doc.
Beats the hell out of stay up here for a month.
Oh my lord, I've already had a long enough day.
Well,
You don't know how long I've been in this freaking in this room. It was
Oh, this is a hotel now.
12
I
EST.
just-
Yeah, it's my hotel room. That's pretty much it. I've been in here and then downstairs.
Well,
I'm
let
gonna
me ask
say,
you a
though-
question. Did you blow that bathroom up like you did Jaden's?
It's been locked. I have been holding it.
Is Jaden out of the ICU?
No, he hasn't even gone into surgery yet.
well, they didn't tell me about a second patient.
Oh yeah,
yeah.
my old B machine owner's son got in a major crash and explosion and everywhere. It was like crazy.
I don't know if
Yeah, he's got a piece of metal potentially in his lung. They're not sure yet.
Oh Lord, I'll definitely talk to the nurses afterwards and see what I can find out. But
Well, as long as you don't kill him, we'll trust you with Jaden.
well,
Yeah, but he'll be your test subject. We'll
Oh,
see
no,
how
I-
that goes.
let me tell y'all a little bit about myself.
Alright.
Fresh out of high school, I enlisted in the United States Army. I was a combat medic. From there, I worked my way through and got my college degree. I was sitting at a staff sergeant and I promoted to second lieutenant. And from there, I went to medical school through the United States Army. After I completed my
You fuckers.
emergency medicine and my trauma fellowship, I was shipped off to Iraq. And I was the primary surgeon at a field hospital, so I got to see the boys as they were being brought off the field, and I was the first one to try to save them.
Yeah, I think
That's-
you're in good hands.
Thank you
Shit,
for your
dude, we're over here
service.
like making jokes, and you're like got the fucking story of a lifetime.
Badass.
Do you want to
Seriously.
know what my background is?
What's that?
Yes.
I
Flicking
fought off
beans.
some. Okay, can you shush? This is my background story. You can say yours later. Okay. It was the darkest stormy night.
Oh God.
Never mind.
All right, yep. All right, have a good one.
I went from being a nobody to being a worker at Beam Machine to now being machine. So yeah, that's my background.
Sounds like a hell of a good thing right there.
Hey, guess what we get? Waffles.
Nice.
Waffles.
Well, I got the OR prepped and ready if you're ready to get started.
I am.
Just be careful on your way out. There's some baseballs on the floor.
I saw those baseballs laying over there.
How long does the surgery take?
Once I get him in there and sedated, we're looking about an hour under the knife.
An hour?
But I can definitely contact
There
y'all
you
after
go.
he's out and let you
You can do
know.
Okay.
We'll see how he's feeling,
Good job.
and then we can see when we need to pull him out of the anesthesia.
Thank you.
My music.
Maybe they'll make you less ugly.
Okay,
I will
well,
punch you, but I'm afraid I'll hit Jerome.
punch him once
That's
I
okay.
leave.
Alright, y'all.
He'll
I'm
be
gonna
alright.
steal him away now, but I'll let y'all know when he's out of
Alright.
surgery.
Bye, guys.
Thanks, sir.
Alright. Have a good one. Good luck, Jerome.
Thank you.
Bye.
Alright, let's get you over to surgery. Oh,
Are you tackling? Oh, okay. I was going to say that would not have been good.
ICU.
Yeah.
All right. See you guys.
Oh.
Bye.
I forget.
Oh, hey guys. I'm back.
Hey, alright, we're done.
Okay. Bye, guys.
That was fast.
It'd be nice if it was that quick.
Yeah. So.
You might need to give your eyes just a second to adjust back here. There we go. I'll let you get comfortable while I get your IV meds. I cannot spell tonight to save my damn life. There we go. All right. Get all this ready here. Oh, there's a horribly long. All right. Can you confirm your full name for me, please?
What's sorry?
Can you confirm your full name?
Yeah, it's gonna be Jerome Brown. October 17th, 1999.
Excellent. And are you allergic to any medications that you're aware of?
No, sir.
Excellent. All right. Well, let's get this started. I'm going to start you with a little bit of a sedative medication. And this is just going to help you relax. This is Ativan.
Okay.
Alright, you're going to have just a little bit of a sting and a tingling sensation in your IV.
Yeah, that's weird.
And as the medication starts to take effect, you're going to see some really pretty colors coming around the lights. And you're going to feel yourself start to relax.
Yeah. Oh my gosh.
Feeling good?
Mm,
Excellent.
nice.
And that's just the start of this party.
Fall. Yeah.
this hooked up. This is your primary anesthetic, and this is what's going to help you go to sleep.
Okay, doc.
Yeah, give me 1 second. Okay, sorry about that. Alright, now start counting backwards from 100. You're gonna feel yourself getting very sleepy.
100. 97. 96.
There we go. How are you feeling now? Excellent. Now we got that taken care of. Alright, let's get you intubated. Alright. Get you up here on this ventilator and we'll get started. Go. Alright, brother, let's get you fixed up here. Alright, currently it is about 8:21 p.m. on March the 9th. This is Dr. Shilan Knight. My patient tonight is Mr. Jerome Brown, born 10/17/1999. Patient is in for extrication of multiple GSWs from an assault class weapon believed to be an AR-15, possibly a .223 or a .556 caliber, unconfirmed. Patient presented earlier to the ER, was treated initially and stabilized, transferred to ICU. This time we're going to be performing extrication on 15 rounds. Primary impact location is going to be to the mid-lower chest and the abdominal cavity. We're starting with a lateral incision across the abdomen. Through the dermal and epidermal layers. Into the sebaceous tissues. Exposing the abdominal organs. I'm able to visualize multiple clots and what appears to be several lead cores to the projectile rounds. Searching through the area, appears no major damage to the vital organs. Bullets will be removed and released to the police department for evidentiary purposes. Patient is currently stable, setting at 98% on a ventilator on a 60-40 mix. Pulse rate is stable at approximately 100. Cardiac monitor showing a normal sinus rhythm. Applying some suction to clear the field of view. Very small bleeder located. Cauterizing the bleed. Bleeding located from capillary vessels of no major concern. Continuing the extrication of the bullets.
I cannot type tonight to save my damn life.
More rounds removed. Bullet came to rest between the lower portion of the large intestine, resting on top of the small intestine. Patient's vitals are remaining stable. Patient appears to be in no obvious distress. Another small bleed from the removal of the bullet, cauterizing now. Bleeding has ceased. Continuing my search for more rounds. Patient appears to have a small horizontal tear to the left medial aspect of the liver. Bullet does not seem to have penetrated all the way through, checking the liver itself. Bullet is within the fatty tissue. And bullet has been removed. Due to the location, I will be utilizing sutures to seal it. Be utilizing a 3/0 vicryl. This will dissolve over time. I will be sealing this wound with a running cross stitch to ensure the most adequate hold and prevent further infection. There we go. Alright, thus far we have 1, 2, 3, 4, 5, 6, 7, 7 rounds from non-bad. Yes, continuing my search for the rest. Checking the bowels. No signs of damage or immediate trauma. Oh, actually, right there, proximal aspect of the lower small intestine. There is a blunt force injury, approximately 2 inches in diameter. Appears around may have impacted, but did not penetrate. Checking the subcutaneous tissues. There you are. Bullet appears to be a round ball, did not fragment or fan out like a hollow point. Sealed up. Excellent. Cardiac monitor is continuing to show a normal sinus rhythm. Heart rate has reduced to 90 beats per minute. Respiratory rate is holding steady at 18 on the ventilator. O2 saturation still 98 to 99%. Patient still maintains no obvious sign of distress. Moving up to the diaphragm to search for the remaining bullets. Oh, actually, that is... There you are. Good bleed located just above the diaphragm on the right side. Appears a vein had been ruptured on one of the gunshot wounds. Bleeding is moderate but containable. Bleeding is now stopped. it's going to be a little tricky with the position it's sitting in to avoid puncturing the lung. I will be using a curved set of McGill forceps. There you are. Removing the bullet. Distal portion of the rib cage. There you are. Trapped in these subacute tissues. Get a hold of this one here. Good. Moderate damage to the lower tissues. Go ahead and place a couple of sutures. Still maintaining the classic running cross stitch to hold the area secure. There we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. Still one bullet unaccounted for. Moving to the left side of the chest. Where are you? Oh. Hell. And the last bullet is now located sitting in the lower portions of the pericardial sac. When I remove this bullet, there will be a lot of blood loss. Suture driver ready. There we go. And here we go. Applying suction to the patient. Heart rate has increased to 128 beats per minute. Blood pressure is still cycling. Will be quite low. Oxygen saturation is maintained. I can quickly suture this closed. Come on, come on. Patient's blood pressure has dropped notably. We're down to 100/55. Almost done. Suction has removed approximately 30 milliliters of blood. There we go. Tearing the pericardium Cardiac sac has been repaired. Patient's heart rate is reducing. Now holding steady at 108 beats per minute. O2 saturation still at 98%. Blood pressure is increasing. Blood pressure is now 120/70. Very well within acceptable parameters. Alright. All bullets have been located and removed. Beginning to close the patient. Alright, suturing the muscle wall back together. Muscles are holding tightly. Placing a muscle stimulator electrode in the lower portion of the subcutaneous tissue to allow for easy therapy to repair the patient's muscles. There we go. There we go. Patient is stable, ending vital signs. Blood pressure is 126/82. Heart rate sitting strong and regular at 90 beats per minute. Respiratory rate still at 18, and O2 saturation's at 98%. Patient will be transferred back to the ICU. Patient should be able to be extubated within the next few hours.
Much better.
Alrighty, sir. Well, let's get you back to your room. back in to check on you in just a little bit. We'll see if we can get you extubated and woke up.
It's upstairs. Oh, you gotta go upstairs. Upstairs, and then go down.
Right. I will be back.
Oh, ICU, not surgery.
And I hope you find something, sir.
Right. Yeah, I'm just here visiting my friend, but my other friend's here to also visit him.
Oh,
He's the
okay.
cripple
Hey,
boy.
Dickie.
He's in here.
God, I love this hospital. Sorry, y'all, I keep having to drop my chat. Good old pharmacy. Let's see what's in here. Painkillers, first aid kits, nice. First aid kit. Nothing too fun.
This hallway.
Oh, hey, Tex. I didn't see you snuck in here. Oh, actually, there's a snack machine. Damn it. I'll get a soda. Or coffee.
Are you dealing with that guy with the spine injury?
I am not. I don't even know about him. I just got out of surgery.
Oh shit. My bad. You good though?
Oh, I gotta find me something to eat, but other than that, I'm good.
Hell yeah. Wait. I might have a burger that's got it. There you go. It's almost there's a
you're
guy
awesome.
on the ICU bed right now. Obviously you don't have to do any surgery right now if you want to. But I put it in the pager. It's got pretty bad spinal cord damage. I was just wondering if you want to check on him if you have time, or maybe give him wheelchair access. Obviously.
What was the cause of his injury?
I think they said something about Mount Chiliad, if I recall. I can show you where they're at in the rooms right now. They're still in there. I just put them in there.
They're in bed number 4.
Yeah, number 4. I just
Awesome.
put him up there, put the seat collar on him, strap him to his bed to, make sure he doesn't move around too much.
Excellent. Well, I need to run down to the closet and find me another mask and some gloves.
Is there a clothing store here right now, or no?
I have no clue on that one. I was fixing to go look.
No, I don't think we have one, sadly.
Oh,
I could
dang.
quickly fly you to a store or drive you if you want.
If you wouldn't mind, there's one just around the corner, isn't there?
Yeah, let me go on duty real quick and grab it, unless you're on duty. Because we'll have to drive to the store right now. Are you on duty?
I am.
Okay, we can just pull one out then. Let's grab an Explorer.
Good old exploders.
It's like around you somewhere, I think. Or is it right here? I'm not on duty, so I can't see it.
Let's see here. Oh, not there.
I think it's like right here or something. 'Cause, 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 'cause
Dancy. I ain't seeing it.
Just go on. You see it.
Is this it? Oh, no, that's not it.
Found it.
Nice.
The clothing store. They really need to get one in there soon.
That would be great.
Oh, nice.
Give me 1 sec.
All good. Huh?
Nothing much, man. What about you?
None. There's no clothing store at the hospital. This is the things we get. This is the things we get.
For me,
This is the things we get.
Hey, we got a beautiful new hospital out of the deal.
It is pretty nice. I did almost burn alive though when our old hospital blew up.
Oh, hell. Well, I appreciate that lift.
Of course, I'm going to go back off duty though.
Oh, you don't want to stay and play?
I came here to give an interview and I'm going to go to bed. Are you going to check out those guys on the floor though?
Yeah, I'll run up there and see them now.
Thank you so much. Yeah, I'm pretty sure you got it. I put it in the pager channel, what the MRI results were, so.
Alright, well, it's going to be a touchy one because if it's a spinal injury, depending on the severity, is not really my forte. I'm a trauma surgeon, not a neurologist.
Yeah, that's what I'm thinking. That's why I just tried to make sure he stays as still as possible in his bed. He says he can't walk or feel his legs or anything, so that's not good either.
Oh, damn. Well, let me make a quick phone call and I'll just go check him out.
Alright, I'll tell him you're on the way then, okay?
I appreciate you.
Of course. And I'll be in the big boardroom for that guy if you need me.
Alright, sounds good.
Like I said, I'm giving an exam right now.
Shiny
I will
pants.
say though, this hallway could kill someone, literally, because of how long it is.
That's good for you.
True. But if you're rushing someone in for the ICU, oh my god. Got Dr. Batman here. We'll let you go in a minute. Okay? Hell yeah. Of course. I'll be with you soon.
Golly, I didn't even realize this was all back here.
What?
I didn't realize all this was back here. I hadn't looked back here yet.
Tucker's office is pretty cool. The one on the very end.
Nice. I'll have to go
It's got
check
a
that
couch.
out.
Oh yeah, there's also a big boardroom. That's what I'm gonna be in right now. All good. I'm not here. I'm just here for the question.
Alright, let's see here. 122. Miss May,
Yes.
this is Dr. Knight.
Hi, how are you?
I'm good. I was just calling to let you know that Jerome is out of surgery.
Okay, perfect. Everything went well?
Everything went well. I've got him sedated and resting currently. I should be able to wake him up here shortly.
Okay, we'll be on our way. Thank you.
Thank y'all.
Bye.
Bye-bye.
Tell that guy I don't need a speedy recovery, get well soon card. I need a wheelchair, goddammit. Oh, hello.
How are y'all?
Oh my.
Oh my.
Yeah, I'm Dr. Knight. Tell me what happened.
I got in a really bad motorcycle accident, and I haven't been able to feel my legs since.
Nicky, step out, please.
And
How long ago was the motorcycle accident?
it was on Mount Chiliad.
Oh, Lord.
I fell down the mountain.
Man, I'm sitting here looking at your MRI results, and there's severe damage to your spinal cord.
Yeah, I think I heard her say something about it being severed.
Yeah. I'm gonna be flat honest with you, that's usually an unrepairable. I'm certainly no neurosurgeon, I'm a trauma surgeon. I can definitely get in there and take a look and see what damage could be repaired. There's a lot of swelling.
Oh God.
But I want you to know that there is an extremely high likelihood that you may never walk again.
Oh God. The voice
Gotta be
really
something, Doc.
really sends it home, Doc.
And I'm not gonna lie to you, and I'm certainly not gonna sugarcoat this. There is a very high likelihood you will be confined to a wheelchair for the rest of your natural life.
Oh God.
But
Should I shave my head?
being in a wheelchair won't need you to shave your head. You're not a cancer patient. But there's a reason
But
why.
like Professor X.
Yeah.
If that's something you wanted to do, that'd be your business.
If I'm gonna be a cripple, I'm gonna be a cool one. God damn it.
Yeah, the choice is certainly yours. Like I said, I'm willing to do surgery and take a look. But I can't promise that I can repair it.
Tucker, I don't know if it's worth the risk.
I don't know. I think it's worth it.
There's a possibility, and I won't know until I actually get in there. We could install a electronic bypass. It's a fairly new technology, but they have had success with it in military patients over the last 10 years.
Oh, that sounds really complicated, Doc. That scares me.
It's a very scary thing. I'd literally be wiring a computer into your spine. But it would give you the possibility of walking again, depending on, again, the damage when I get in there. If you need
Tucker,
some
I think you should go
time,
with it.
I can
I
completely
don't know,
understand
Tucker.
that.
I don't think you. I think you should wait, Tucker.
No, Tucker. You already can't walk as it is. You should just do it. What worse could happen to your life?
Well, Tucker, let me give you the choices that I can give you right now.
Okay. I'm a
There's,
little overwhelmed right now.
that's okay, and that's why I'm going to give you the choices. I'm going to give you some time to think about it. Right now, I can give you medications that will make you comfortable, reduce the swelling, and we can take another MRI here in a few hours. we might be able to get a better picture to see the true extent of the damage and not have to go in blind. That would be the most optimal. The other option is a very radical surgery, and like I said, if this MRI is correct, then you will most likely never walk again. So if I was laying in this bed in your shoes, personally, I would want to try to reduce the swelling to get a better view before we get in there. But the choice is yours, and yours alone to make.
Oh man.
Look, Tucker, I think you should go with option 1.
I thought you said to get the surgery.
Well, that was before I knew that there's a better chance if we let the swelling down that the doctor would have a better chance and increase your odds.
Yeah, but if we wait, isn't there a chance it could get worse?
Realistically, if this MRI is correct, there's no way that it could get worse. But with the swelling reduced and a clear picture, that would also give me time that I can possibly chase down a neurosurgeon.
I don't.
We could also put you on a medication called gabapentin. It's an oral medication. It's an older one, but it's very effective in protecting the nerves.
Tucker, I think you should just go in the wheelchair, man. I don't know if it's worth your life to get a dangerous surgery.
Well, his life would not be in the balance here. It would be whether he could possibly walk again or if he is permanently confined to the wheelchair, because as he sits this moment in time, the answer is a wheelchair. Like I said, Tucker, the choice can only be made by you. Nobody else can tell me what they want.
Come on, Tucker. Go with option 1. I think it's the best chance you got. Let the
Go
swelling
with
die
your
down a
heart,
little bit.
Tucker.
Tell you what, Tucker, I've got a couple other patients I need to check on. Why don't I give you a little time?
Okay. Yeah, I need some time to think about this.
It's a hell of a
It's all so
decision.
much. Yeah, it really is.
Are you a religious man, Tucker?
Not anymore, Doc.
All right. Who's your most trusted friend?
Alright, Tucker. I know you'll make the right decision, brother, but I gotta get going. I'll send a get well soon card and all that fun stuff. Maybe a gift card to something. I don't know. But I gotta go. I love you, Tucker.
All right, Brad.
I swear to God, if you're going back to that truck.
I ain't going back to that truck, Tucker.
Be back.
All right, Doc.
Brad, wait. Wait for me, Brad.
Doc, you should probably come back in a little bit. I'm gonna watch out the window and make sure he's not. Gonna see if he's trying to take his truck back out.
Alright, I'm gonna leave you orders for pain medications and for some anti-inflammatories. We'll at least get started on trying to get that swelling reduced. But
I'm not in any pain. I can't feel a thing down there. But is that just to help with the inflammation?
it is to help with the inflammation. And understand this.
Okay.
You are disconnected from the lower part of your body. So while you're not feeling pain, it doesn't mean that that part of your body is not in pain. With all the
This is
swelling,
also confusing.
it's a lot to take in, and I completely understand that. But the nurse will bring you medications in and get those administered. But I'm gonna go check on my other patient, and we'll be back here shortly. Okay?
Okay, Doc. Thank you.
I'm gonna leave my card. If you need something, send me a text message.
Okay.
I'll check on you in just a little bit.
You're so cool, Dr. Knight.
It's like Batman.
Let's step down here.
Doesn't look good, does it?
His prognosis is not good at all.
God.
Most likely he will never walk again. But there's a lot of swelling, a lot of inflammation, so I can't get a good clear visual of the entire spinal cord on that MRI. I recommend that we treat the swelling and inflammation first, and then we can look to consider our surgical options, because the only surgery I could possibly offer him would be a very radical surgery. I'd be going in blind, and if the damage is accurate to this MRI, the only possibility is to install basically a replacement. But
Cyborg.
it would basically place a computer into his spinal cord.
Oh my god, he'd be bionic.
And he'd also be looking at,
Show lab rats.
to a degree, but he would literally be looking at years of rehabilitation.
Oh my god, not like lab rats. More depressing.
It would be a very hard road that he would face.
Oh my god.
But I didn't sugarcoat anything. I gave him the options that I realistically can provide him.
Yeah, gotta let him weigh his options in this scenario.
Give him some
I know.
time.
I know whatever choice he makes, you'll give the best of your ability, Dr. Knight.
I will always try to.
You're so cool.
I appreciate that.
Who's Dr. Knight? Also, I opened the bathroom up for that one lady, and I think she took a huge dump, so you might want to put your mask on when you go in there.
You know, I smelled some of the worst things on some of my medical missions. I don't think that's going to bother me one bit. I just came back from Nigeria, so
Jesus.
been
You're
doing.
like a badass war hero.
I did my time in the army.
Now I know why they call you Dr. Batman. Besides being awesome and cool, you're a double awesome.
It's just the voice.
And you're a war hero.
When I finally got out of the army,
Roy?
I was a lieutenant colonel.
It's Dr. Batman.
Yeah, it's Dr. Knight.
He's a war hero.
The war?
Yeah.
I would not call myself a hero. I just did what I was asked to do.
So cool.
Yeah. I'm gonna go check on Jerome, see how he's feeling, and if he's stable enough, I'm gonna go ahead and pull him out of the anesthesia.
Got it.
Y'all let me know if y'all need me.
Yes, sir. Sir.
Brad, I don't think that you should definitely pit that truck right on.
Oh, hi, Dr. Knight.
Try to get him
There we go.
shoot the driver.
Hello, doctor.
Alright, let's see how he's doing. He's looking good. His O2 levels have been quite nice. Alright, let's see if we can get him
Yeah, I
extubated.
had, Van check on him. He said that he's leaving Adrian with him.
Alright, I'm gonna give him just a little bit of a countering agent here.
Oh, his foot's twitching.
Narcan, you on drugs?
Oh, he's highly medicated right now. Narcan counters opioids.
Remy better not become a opioid addict after this.
Hey there, Mr. Brown, how you feeling? Don't try to talk, you still got a tube down your throat. Alright, take a nice deep breath in for me. And blow out. There we go. Alright, now don't try to talk a lot right now. You're going to be pretty sore from that tube. Here, take a drink of this. There we go. And how are you feeling?
Good.
Excellent. Well, you came through the surgery very well.
Everything else.
I was able to remove all 15 bullets. But you did have one bullet that was in a rather nasty spot.
Were you able to grab it?
I was. The bullet had nicked the lower part of the pericardial sac, which is what contains your heart. It was a small laceration that was caused, and I was able to close it and repair it. But
Well, that's good.
Whoa, you guys are what? I thought. Oh, hello.
Hi.
Hi.
Hi. Oh my god.
so you're definitely going to have to be cautious, and you're going to have to stay away from any heavy cardiac-involved activities for a little bit.
Probably gonna just sit on the couch at being.
Yeah, I definitely recommend you take a few days off.
Well, you can just watch us work and sit on the couch.
Yeah, we ain't gonna have any more problems with any more drive-bys, are we?
I hope not.
God, no, dude, I'm gonna hire security. Can you not say right now?
Sorry.
Well, I know you're still gonna be groggy for a while, but I will write up your discharge orders. I definitely wouldn't have an issue with you being released here tomorrow or the next day. As long as your vitals stay good and we don't see any post-operative complications, which I've got you on a lot of antibiotics and pain medication right now. But I think by tomorrow I wouldn't have any issue if you wanted to go home.
Well, that's good.
Do you have anybody that lives with you?
No. Well, no, Katie has keys, but that's it.
Well, do you have anybody that mind coming to stay with you for a little while?
Question for her.
I mean, I can. Yeah.
I mean, he'll be able to take care of himself for the most part. I just feel a lot better if somebody was staying there with him. That way, if he...
That's understandable.
You said he can't be released until tomorrow.
Yeah, I need to keep him at least till tomorrow. But I won't...
You know about what time?
Realistically, I know it's a little late right now. What time is it in your head right now? Basically, anytime after 4 o'clock tomorrow.
In the morning?
Sorry, doing a little math in my head. If we're gonna do a morning release, let's go for 8 o'clock. Otherwise, the nurses will choke me.
I'm sure I'll be here. I'll come pick him up.
Okay.
I'll just go take him to Bean and let him rest on the couch while we work and he supervises. So.
Yeah, all right. Well, at least until Miss May's available. But after that, you definitely need to go home and rest, okay? All right.
Okay.
You better listen to the doctor, okay?
Mm-hmm.
I know it's not the answer you were probably hoping that I would have for you, but this beats the hell out of staying here for a week or two.
Yeah.
So, we'll do that. I'll write up your discharge orders, and any of the staff can do the discharge once I have the orders turned in.
You said 8 a.m. tomorrow?
Yes, sir. Any time after that.
Okay.
I'm sure you'll...
I'll wake up pretty early. I don't have any Liberty work.
I got you. Well, I will have everything ready, so that way all you'll have to do is let them know down at the reception desk, and we'll be good to go.
Alrighty, well, thank you.
Not a problem, y'all. And Jerome, I will need to see you back here probably in about 4 or 5 days, okay?
Alrighty.
So I'll attach my office number to your discharge. That way you can just call me.
Yeah, thank you.
All right. Y'all let me know if you need anything.
Alright, thank you.
I don't want to wait.
Hey there, guys.
Are you still here?
I probably should go
Tucker?
for him.
I am.
Out, right?
Tucker just started taking. He said he wants the one where he will be able to hopefully walk again.
Either direction we can go.
I think he said he wanted the soonest surgery possible.
Okay.
I think he wants to walk again.
Yeah, it's up in the air either way. Once I get in there and I can see the extent of the damage, then we'll know more.
Hopefully he'll pull through.
Okay. I'm gonna go prep the OR.
Okay.
And we'll go from there.
Okay.
Tucker, you still with us?
Oh, what's that?
Oh, is he sleeping real good right now?
Sorry, I took a quick nap there for a second.
Ah, there we go. Alright, brother. So, just to be clear, either way,
Yep.
whether we wait on the surgery or if we do it now, I just want you to understand that the most likely outcome is a wheelchair, but I won't know more until I'm actually in there or I can get a clearer MRI.
Okay.
So I just want to know that you understand that.
Yeah, I get it.
Okay. I can promise you I will do everything within my power to repair the damage, if it's repairable.
All we can do is hope at this point.
Yeah. It's gonna take a whole lot of hoping. But I promise I'll do everything within my power to give you every possible chance, but depending on the extent of that damage is gonna be the deciding factor. We may get in there and the damage actually isn't that bad. It's just nerve clusters that are pinched in between vertebrae. I can easily clear them and get them stabilized, and it'll take a few days for the swelling to go down, but after a few days you would be walking. But if it's completely severed, then the only option I would have to even give you a possibility of walking is that very radical surgery. And understand with that, you would literally be learning to walk again. It would be months, if not years, of intensive rehabilitation therapy.
So, either way, it's gonna be a while before I'm back where I was then.
Yeah, it definitely will be.
Alright.
So, if you're sure, I'll go prep the operating room.
Okay.
So we're using walkie-talkies right next to me.
Okay.
The closer we get to it, the more nervous I'm getting about it.
Alright. Tell me yes or no, surgery or wait.
I think I'll just take a wheelchair and just wait. I don't know about all this.
That's a lot to think about, it really is. But I can let you sleep here in the ICU, and we can definitely address it tomorrow.
Will
But
the damage get any worse if he
if
takes
he
a wheelchair?
if he moves from this bed for any reason, the risk of permanent irreversible damage is guaranteed.
Alright, we'll just we'll do it now then.
Okay. Let me go prep my OR, and I'll get you here in a few minutes. If you need to make any phone calls, now's the time.
Okay.
Alright, I'll see you in a few minutes. Oops, sorry, y'all. I keep dropping my damn chat.
Hello.
Oh, hey there.
The lobby is now too big for me to yell across, going hello.
Yeah, it is quite a hell of a lobby.
It really is. It's a hell of a building.
It is, but damn, I love that OR. I'm fixing to go in for my second surgery of the night.
Oh, damn. Yeah, the OR is pretty cool.
Okay, so where would you check in if needed? Is it right here?
Yep, right here.
Right in the center there.
I'm gonna do it for shits and giggles.
Okay.
La 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 la.
You need to let me do that so no one hears it.
Hello, this is Dr. Batman, by the way.
Oh, hello. Nice to meet you.
Dr. Knight.
He's a ward
That's a
leader.
good one.
The police are looking for you, by the way.
They are.
Yeah, they're right over there, actually.
And
Yeah, they're inside and looking for you.
Oh, cool. I'll run in and talk to him. Can I steal any of y'all for surgery?
Yeah, both of us.
Awesome. I'm gonna need some extra hands for this one.
I'll go off duty then. Yeah, man. Just try not to wear the outfit on duty as well. Yeah. See this bike over here, yo?
Where'd they go?
I wonder if they went upstairs.
Probably. What's the surgery that you're doing?
It's gonna be on that spinal cord.
See if you can get walking.
It's a radical try, but we'll see what we can get accomplished. You're looking for me.
There he is.
Hello. Scared me.
There he is.
I'm scared.
Yeah.
Why are you scared?
Why are you scared?
His voice scares me.
Or you? She's being a
Okay,
bitch.
sorry, yeah,
she's being a bitch.
Nothing to be afraid of, ma'am.
Thank you. There he is.
She's
The
just
one and
afraid
only
of
best
male
surgeon.
masculinity.
Yeah, I know.
Because
She's
her husband's like, oof.
he is a bottom as they've ever come.
Like, if you have the definition of beta on a dictionary, it's her husband.
Picture of him.
I don't know what you want me to say.
She has no comment.
See,
She wears the
doesn't
pants.
defend it because she knows it's true.
Yeah, she wears the pants. It's okay. I respect it. I respect a woman that can wear the pants in the relationship.
Yeah, that's hot.
Always good to have a strong woman.
Yep. Well, I mean, it's not saying much for her, but yeah. Stronger than him.
Oh, Lord. What can I help y'all with tonight?
I don't know. He said he wanted to come over here and see you.
You know, when you did surgery on the other day on my arm, I totally got into 2 shootouts that night and fell off a building. Everything's good though.
Jesus.
Desk duty went well.
So
What'd you do on desk duty?
Got in 2 shootouts and fell off a building.
That's not desk duty.
So I'm gonna note to myself next time it'll be bed rest for a month.
Oh no.
Didn't you can't put him on bed rest, Doc. He lost the house in the divorce.
Oh, I didn't. I gave it up.
Oh,
I have a new house.
Oh, you have. Okay, never mind.
And I already have somebody sharing it with me.
Okay, never mind. You can put him on bed rest then. Who are you sharing it with?
Serrano.
Oh my god.
What do you mean, oh my god?
Jeffrey, I need you to calm down. Jeffrey, please.
Where's the fucking roof in this bitch? Like,
You gotta take the other elevator
is this higher? Is this roof higher than Pillbox?
by a long ways.
Alright, fuck.
Oh yeah.
He's following PD tradition. Way to go, man.
Oh, good Lord. Why can't people just go out in a blaze of glory?
I'm really honest with you, Doc. That's just been PD's thing since I've been around.
Yes, Silas told me a
Pillbox
little
it
bit
is,
about
and
it.
off you go.
That's a sad deal right there.
I hope that medic went to go stop him.
Maybe.
Wrong. Yeah, or he may give him the keys to the damn roof. I don't know.
He may give him the keys to the roof.
Roy's kind of old. He don't know what he's thinking about anymore.
Oh.
Oh.
Oh. What?
I think you might have a little work ahead of you.
He just went off. Yeah, we have a down officer call on Carcer Way.
Oh,
Yeah,
That's,
he
where it's at.
totally didn't
I'm
jump
not on
off
duty.
of the building or anything.
Oh, Lord.
Well, Roy didn't do his job.
Hey, we have a
As
doctor on
always.
duty for Peters.
Oh, how many surgeries are you doing today, Dr. Knight?
I guess we're up to 3 now.
Oh my god!
He's over here.
Oh, my head.
Oh.
Guess I'm gonna have to go back in. Good Lord. Let me go back to the elevator. That usually fixes it. There we go.
Being brought into the front.
Uh,
He's being brought into the front.
Take me to the light.
Here you go, sir.
Take me to the light.
He's
Yeah,
on
he
the
may
front.
also
you
need
been
a
here?
5150.
Take me to the night light.
I don't know where to go.
Get it? Night light?
Same traffic.
If he goes anywhere near that light, I'll kill him myself.
Yep, here it is.
All right, let's get.
HD.
All right, let's let Nancy check him in real quick and get him stabilized and prepped.
Oh,
hello. Oh, please don't touch me there.
I
Oh,
apologize, Grant.
Ma'am,
I'm not touching
ma'am,
you
you
anywhere.
either no.
Get your hands off of my
Get off me!
captain.
I would love to. Oh my god. My significant other would not be happy.
Oh, you guys
my
official
bad.
now?
Who?
You?
Yeah, but who? You say you guys? Who are you talking? Oh. Sips all on.
What the? Oh,
All right.
do you already have one person in the surgery room?
I haven't moved him yet. He's still in ICU.
Oh, it's the guy with the back.
Yeah, that's gonna be a marathon.
He's the XD.
All right.
Who are you talking about when I said my significant other? Do you know?
I don't, but I'm just saying you guys are together? Like,
Yeah,
oh,
yeah,
that's
yeah.
cute.
Yeah, we are.
All right, Peters, could you feel this?
Oh, not well.
Feel what?
Same.
I don't feel anything. Sir, I might need some cocaine.
No.
No, no cocaine. Hold on, I'm gonna pull your boot off here.
Where'd my ankles go?
Oh my god.
The criminals. They broke them.
That would probably be the fall that did that, not the criminals. Ah, Peters, can you feel this?
Yeah, oh, I feel it. It's light.
Yeah, let me press a little harder. Do you feel the point? Alright, Peters, wiggle your toes. Good. Alright, can you move your fingers? Excellent. What'd you land on, your head?
No, my dumper.
No. Well,
All those burgers gotta go somewhere, you know?
He's with Dr. Ned right
alright, let's see here. Why in the world did you jump off my damn
Yeah.
roof?
Oh my god.
Hello.
Hello.
I fell. I tripped.
Hello, it's me.
Oh, that's a very nice brush. Where'd you get that?
You know, Peters, your damn pupils are pinpoint. You taking your meds today?
But I gotta go to the flea market.
Yep. They were prescribed by to me, obviously.
Like that for my girlfriend.
Alright, hang on.
I'm gonna tell you, these brushes are great for
Said it was the inside of a bunch of pills and I needed to snort it. through my nose.
Sure, let's see.
Were they lying?
Baseball bat.
A phone.
Hello. Got a
Oh.
hammer?
Oh, wow.
Never known you need those.
Fair enough.
There we go, Peters.
Do you have anything else in there?
What's this gonna do?
It's a countering agent.
Oh.
Never known you need to slap someone?
They're inflatable. You just
Oh, wow.
bop them together. They like.
Oh, like
inflatable.
emergency like airbags.
Yeah.
Oh wow. Okay.
And I also have some lighters if you need a light.
Can I have one?
Oh sure.
No, not. Oh, not like that.
Oh my
Can I just have a lighter, not light?
There we go. Now, how are you feeling?
Oh, thank you.
I feel better. I feel calm.
Thank you.
No more inside
I
of
appreciate that.
pills.
Okay, I'll make sure not to.
Alright, slide your boots back on and see if you can stand.
You got that, Langston?
What?
No more cocaine. No more pills.
I got it.
Don't let me do it.
I got one.
God,
Okay, no
what
more.
happened to him?
Okay, bye, best.
Alright, Peters, go ahead and try to stand.
Thank you so much. Flame on.
No.
Well, that's rude. She's a ginger already.
Anybody got an extra cheeseburger or anything?
I got fries.
That'll work. I'm starving like a fat kid in a dodgeball tournament.
Oh, like Reese?
Oh wait, are you Miller?
Yeah, are you Reese Miller?
I have no clue who that is.
You'd see him. Well,
Yeah,
actually, sorry,
you'd see-
you'd hear and feel him coming.
Wait, hold on. Have you ever seen Puff the Marshmallow Man from Ghostbusters?
Oh yeah, Mr. Stay
You'd see him
Puft.
come around. You'd see him come around a fucking building a mile away.
Dear Jesus.
You'll be sitting in the hospital and you're gonna hear, and that's him running down the street.
That's a little disturbing.
Oh
Alright,
yeah, it's
y'all.
pretty scary.
I gotta get up to surgery. I got a marathon coming up.
Well, just thought, hey, show him your ass. Show him your ass cheek. I am the sexiest IA captain.
I'm the assistant sheriff.
What the hell, assistant sheriff?
Yeah, ass sheriff.
It goes sheriff, under sheriff, and then I think they felt bad for me because I've been in BCSO so long and they didn't want me to be in a commanding position anymore. They wanted me to be higher, so then they made up assistant sheriff.
Yep.
Wow.
And then I just gave myself the
Yeah.
sexiest IA captain.
It's just
title.
like I am a self-imposed captain. I'm not actually a captain, but everyone
MDT
calls
captain.
me captain anyway, so we're good.
Under
there.
sheriff. Wow, when did they bring that back?
8 months ago? 9 months ago?
Yup.
Oh, good lord, it'll be rolling
I
in
think it
his
was around the
grave.
time. I would say it's around the time
It was
that
June.
I got captain.
Because Novak got lieutenant because she got under sheriff in June, and I
Yeah, and
got
I got-
lieutenant
and I was-
of FTP in June.
And I was captain by then. Yeah, so it would have been around the same time. Yeah.
Yeah, about 9 months ago.
Yeah.
Right on.
I was pretty close.
Been a lieutenant for 9 months.
So when we leave here, we gotta look cool, right? You can't let them know that you fell. Alright, let's do it.
Something cool.
Let's do that surgery, yo.
Alright, I'll go get the OR prepped when you go grab the patient.
No idea where Roy's at. This is by you guys.
Wow. Okay, that's
Wow.
just rude.
My bad.
You may walk cool, but you'll never sound cool.
You've got a point. Just, okay, where's the roof?
Well, I don't make any sound. See, that's why I have this.
Yeah, be careful. Try not to get nobody shot for the next little bit. I'll be tied up.
Alright, I'll attempt to.
Gotta
The
get back
elevator, the
upstairs.
same way we got in, Nightly.
Oh, wait, parking is over here. Parking, right ahead. It's snowing.
patient down now?
Yeah, go ahead and bring him in here.
Alright, I'll get him. Coming. You got this, man. I believe in you and Dr. Knight. Oh. Can you see?
Oh, yeah, it might take.
Okay. Just tell me if you can't see, you know?
I'll say it may take his eyes just a minute.
Yeah, no, I can see.
All right. I think I'd end up being the first one using this damn hybrid room, but.
Huh? Can you bring your phone out for us, man? I got an idea. There we go. Can we all see him now?
Yep, we're good.
Good. We're in here, Roy.
Please tell me I'm gonna be asleep for this one.
You are going to be asleep for this one. This is going to be a lot of repair work that I've got to do. And as we go through this surgery, we'll learn more and more about the extent of your injury. Like I said, it's a long shot, but I'm going to do everything I can for you. Alright, y'all, let's get this started. Let's get 2 large bore IVs. You should have 1 access already. Let's get a bag of normal saline hanging on one. We'll get IV medications on the other. Are you allergic?
I'll get the saline IV.
Awesome.
And I don't get pain medication to start with.
Brother, you allergic to any medicine?
Sir?
Sorry. What?
Are you allergic to anything?
No, not that I know of.
Ever had like a certain pain medicine you like, I'm feeling real itchy?
Yeah, no, I've never had anything like that.
Good deal. Alright, let's give him, once you get that access, let's give him 5 milligrams of Ativan IV, and then we'll start him on a drip of propofol.
I'm gonna push those 5 milligrams through, and I'll start his propofol.
Excellent. Brother, that Ativan's going to make you feel very relaxed, and as it takes effect, you'll start seeing really bright colored rings around the lights. Don't let that alarm you.
Okay.
And the propofol will be, if you use a 10-drop set, we're going to be about 50 drops per minute for his size.
Alright, get that propofol hooked up ready.
Alright, I'm going to mark the incision sites while you're doing that. Alright. Once he is resting comfortably, we can get endotracheal intubation going. He should be a 7.5 ET tube.
You're starting to pause?
Good. Go ahead and prep him with 10 milligrams of that propofol direct. And just draw it straight off that bag. There we go. Y'all go ahead and perform that intubation. Excellent work. Alright. As soon as you get him intubated, I'll start the recorder.
Alright, putting intubation tube in now. There we go.
Damn, good technique, Roy.
Thank you.
Alright, let's put him on the ventilator. Since I'm working with nerves, let's do a 80% oxygen, 20% room air.
Get that, Marley? 80% oxygen, 20%. What did you say, Doc? Air there?
Room air.
Room air. There you go.
Yeah, I got it.
Alright, Tucker. You hold in tight there, brother.
I had my scrubs, but they were in a pillbox and they got burnt up.
Mine too.
Alright, y'all. And what's the time?
10 a.m. exactly.
Alright. It is March the 9th, 2022 at 10 a.m. This is Dr. Shilan Knight. I'm performing a radical repair on a trauma patient to their lower spinal cord. Initial MRI shows severe swelling and unable to determine for certain, but appears to be a complete sever of the spinal cord. I will be performing an incision starting at L5 in the lumbar spine, tracking downwards to the mediation point with the hips. Good incision. Folding back the dermis and epidermal layers. I'm able to visualize the outer aspects of the vertebrae. And how are we looking on those vitals?
Looking good, looking good.
Excellent. Ooh, he's got fragments. There was a fracture here as well.
What the fuck did he do?
Oh, what's that beep?
Looks like it's his heart and some breathing starts to rising a little bit.
Alright, let's go ahead and administer 25 milligrams of etomidate.
Do you want to do that, Roy, while I keep an eye on his vitals?
I got it.
See if a little extra sedation, pain medication will help. I'm sure he's on fire right here.
Yeah, his heart probably does not like this.
Alright, I'm clearing debris from the field. And I can see the spinal cord. Oh god, it is swollen horribly. Alright, let's see here. We're just gonna take a nice, easy look. Looking for any signs of tearing. The swelling is so bad. I mean, honestly, I would.
Never seen. What the fuck?
This sucker is almost 2 inches in diameter right now. It's swollen so bad.
I feel like you got hit by a car head on.
There's a motorcycle accident on Chiliad.
he probably like fell off his bike and slammed his back into a rock.
If it was Juliet, he could have fallen for an unknown distance. Hand me a sterile syringe with a 4-inch 18 gauge on it. See if I can drain off some of this fluid. Thank you. Alright. Performing the needle decompression. Alright, slowly drawing back. Fluid is mostly clear. A little bit of cloudy. Advancing the needle. Oh, come on, Tucker. Here we go. Alright, drawn off this syringe. Hand me another. Thank you. Alright, drawing off one more fluid. There's no blood.
Looks like it's doing something now. Fluctuating. His vitals are, they're a little, I mean, they're, not doing anything too bad that we should worry about, so. Just kind of going up and down a little.
Alright, just let me know if his heart rate spikes and his blood pressure drops. Drop.
Need that happen.
Nah.
Yeah, it's just fluctuating a bit. It's, shouldn't be nothing too bad yet.
Alright, there's another 10 cc's of fluid. It's clear. That's a good sign. If there was a tear, we'd have blood. Hey, Roy, will you tilt him up about a ½ inch towards you? Just very slightly.
There you go.
There we go. Perfect. Hold what you got. Let me maneuver in here. I wonder if he's got an interior compression. Alright, let me check for a compression or see if this is actually severed. Moving very carefully here. Checking. God, the swelling is so bad.
Last time I've seen swelling like this is when somebody I used to know got punched in the nose and it was just bad.
Shit. There it is.
What?
It's on the other side. It's severed. It's about 2.5, 3 centimeters severed.
Sounds like he's gonna lose some height.
That's what I was afraid of. No.
Oh, shit.
so we've got a 2.5, 3 centimeter tear. That means that viably we still have about 3 centimeters. So, will y'all grab me from the supply cabinet over there? I need one of the neuro electrode kits.
Alright, let me go grab that.
We still have some viable spinal cord. If I can implant the electrodes, it may never be like running marathons or anything, but just maybe. Especially if I can get all this stabilized. We can give him a possibility.
I believe in you, Dr. Knight.
Yeah, we're gonna try. Thank you, Roy. Go ahead and pop that open for me. Perfect.
Alright, got it all opened up.
Perfect. Okay. Now to stabilize this, I'm gonna have to do a fusion. I'm gonna need let's do 2 6-inch titanium rods, and grab the bone cement and 4 set screws. Let's do 1.5 set screws.
1.5 set screws. So grab 1.5 set screws, bars.
Alright, I am applying the first electrode.
Ready.
How are we looking on vitals? Are we still stable?
I'm not seeing any changes.
Excellent. Alright, first electrode is placed. Checking connectivity.
Sounds good.
We're green. Okay. Alright, first one's in. Come on, Tucker, you gotta fight through this. Shit. And the body's not gonna respond to it. It won't hold a pattern.
What do we gotta do in this situation?
Yeah, unfortunately. Alright. Go ahead and hand me that first titanium rod. Let me get this out of the way. God bless.
Here you go.
Thank you, sir. This takes me back to my days in Iraq.
You have to do something like this?
More times than I care to remember.
Oh, shit.
We're just kids that I had to try to piece back together. I had to take their arms or their legs and try to piece back chunks of meat.
Jesus Christ.
God.
Jam me a set screw, please, sir.
Yep. There you go.
Thank you. Alright, securing the rod. God first screw is set. Would you hand me another, please, sir?
Yeah. There you go.
Thank you. It just breaks my heart. Another young person is not going to be able to enjoy life to the fullest. There's not a damn thing I can do about it. His injury is too severe. Alright, first rod is secured. Would you hand me that second one, please, sir?
Yeah. There you go.
Thank you, sir. Placing the second rod for the fusion. Would you all grab me a roll of the surgical mesh? Let's do the 4-inch roll. That should work perfect.
Alrighty. There you go.
Thank you. Alright, let me get this mesh secured here. Alright. And would you hand me a set screw, please?
Gotcha.
Thank you.
There you go.
Get this in place. And first screw goes in place. Alright, can I get that second one, please, sir?
There you go.
Thank you, sir. Alright, get this secured and clear fluid with no blood return. He's leaking spinal fluid into the ruptured area. Once I get this mesh secured, we'll install a drain so that it can be easily addressed. Cauterizer, please. Should be on that little tray right beside you, unless I moved it again.
What was it again? Sorry.
Got it.
The cauterizer. I was just zoned out with this blood.
Oh, you're good. Thank you.
There you go.
That'll stabilize the rupture site. Suction, please.
I'm gonna go just suction it for you and got it right here.
Okay. If you'll approach at about a 45-degree angle towards me, it should be perfect. just make sure we got everything taken care of. Searching the area. Alright. I'm not seeing anything else. Alright, let's get him closed up. Y'all prep a needle driver with some 505 please.
You get that, Marley?
Oh, gosh. Thank you. Alright, beginning the closing suture.
Alright, you want me to wash up and talk to his buddies?
I appreciate it, Roy. I'll talk to him. Your friend's gonna need a lot of help and a lot of care now, because unless some medical miracle happens, he's gonna be confined to that wheelchair. The only possible option I had was the possibility I had to repair it has failed.
Hopefully a medical miracle can happen. Hate seeing people not be able to do things to their fullest. Those fucking gunshots.
There we go.
Hell yeah.
Here we go, y'all.
Alright. Yeah.
Would y'all mind taking him back to his room? And keep him sedated and intubated for a while.
Yeah, I'll only put his IVs on this roller here. Put the bags up.
Appreciate y'all's help.
Help you,
Dr. Batman.
get his legs and stuff up on over.
Sorry, Tucker. There wasn't any more I could do.
Whoa, Roy. Oh my god. Here we go. Let's get him on the roller here. He'll be back in room 4, Dr. Knight.
Thank you.
They were in the, they were watching over here.
Is he okay?
He's still alive.
That's good. But
The spinal cord was blown out.
oh my god.
There was severe swelling. I tried to reduce it by drawing off some of the fluid, and it was clear spinal fluid. There's a very small piece of spinal cord that may not be blown out, but it's not enough to support the electrode function that'd be required for walking.
Yeah. So he's never gonna walk again.
He's gonna be confined to a wheelchair for the rest of his natural life. I tried the electrodes, but as soon as I got it placed and went to check it, his body started to have a reaction and reject it.
That's not good. Is he awake yet?
I've still got him intubated and sedated so he can rest. I was able to do a fusion and fuse his spinal cord. So the vertebrae will now act as a shield and a support for it.
Yeah, it happened to my cousin. He broke his neck a few years back in football. They had to fuse a few vertebrae, but I mean, he could still move.
Yeah. If it would have just been the vertebrae, this would have been a very easy procedure. But sadly, Tucker won't be able to walk anymore.
I don't know what to say.
I understand on that one. He's gonna need a lot of help.
Yeah, I'll be with him.
Going from being a fully functioning person to being a paraplegic is a very drastic change, a very traumatic event.
Yeah. Well, he's gonna get better upper body strength, I guess.
Yeah, I mean, he's got possibilities there, but he's got a long road to recovery.
Yes, he does. We'll be with him. He's got good friends. We'll take care of him.
I have no doubt that y'all will. I'm gonna keep him. I have no doubt that y'all will. I'm gonna keep him sedated tonight and just let him rest. Tomorrow I'll extubate him and I'll see how he's doing. He's probably gonna be in the hospital for a week or two at least. They were just now taking him back to his room. You're welcome to go sit with him if you'd like.
Alright, I'll go do that.
I'll be in to check on him shortly.
Alright, thank you very much.
You're welcome.
You've done a lot.
I wish I could have done more.
It's always the way it is.
Unfortunately. Okay, now we got that done. Sorry, y'all, I was completely ignoring the chat. Wait, which silo? Oh, the silo existed on Legacy. It's been quite some time. He died back January 13th, 20? Yeah. It was just now the second Or was it 21? Shit, I can't even remember. I'd have to look. But yeah, he was here and then he died.
I got him up in the ICU room for you, Doc.
I appreciate all of your help tonight.
Of course. You did your best, sir. I'm sure he'll pull through. Well, he has to pull through.
I mean, physically he will live, but
Means for you.
it's gonna be.
Doctor.
How are you? Oh, actually, it should be about time I can discharge my other patient. Alright. Yeah, this is definitely the cruddy part about being a surgeon.
Yeah.
Yeah, you holding up after watching that?
Ooh, it was intense.
It's easier when your patient looks like they've been doing a meat grinder, honestly.
So gross. I've been in a few surgeries before. I've actually been the unconscious one a lot, but you know, I've helped out Jay some, so.
Nice.
Crazy though, crazy. I've never seen a back that fucked up before.
Yeah, especially internally, you don't get to see a lot of that. Yeah, you did well in there, and I don't know when they're going to do the next round, but you might think about putting in for medical school. I'm going to see about taking on a resident this next go around.
Hell yeah. You'll definitely get it.
Trauma is definitely a difficult one to do, but especially around this town, it'll keep you busy.
Oh, for sure. I mean, we just had like a lot of people come in at once. It's crazy.
I was thinking I was going to do one surgery tonight, but sometimes that's the way it goes. Sometimes it's just a little crazy.
But you did really good, doctor.
I appreciate that.
Of course. Now I gotta pass out in this elevator. Do you need me for anything?
No, thank you again for all your help.
Of course, doctor. I'm always here for you.
Be careful now.
You too.
But we were having a discussion behind the building. Mikey was there, and he said that he made some calls last night to figure out who, you know, did what they did, and what is that, Is it Vagos? So, yeah, Yeah. They ended up getting mad because they thought that Mikey was pointing the finger at them. And they ended up coming up there and harassing Mikey, put a bag over his head, handcuffed him. Yeah. I don't know. He didn't say. But I don't think so.
Charting.
I do not have it either. I'll have to, maybe Katie can send it to you. No. Hey. Ben. But, yeah, there was probably like 20 cars at Bean. Yeah. I mean, to say the least, though, it was popping. The cops are coming in, buying coffee, and, you know, talking to us about everything. I don't know if anybody asked, but somebody did get kind of sassy with them, saying, you know, y'all are out here worrying about masks, but y'all aren't worried about the stuff that needs to be worried about, basically. But, the reason why Tyrone got tasered is because he walked in and threw a snowball at the cop's face and then just ran. I'm not gonna lie, it was actually pretty funny, but it was bad, very bad. He chased him down. They put him in cuffs, but they ended up letting him go. But in the process of, who's that? Okay, they're going for somebody else. But in the process of all that, while they were chasing Tyrone, Finn's been in a kind of weird mood today.
Sorry,
And
must have been in there.
Because, I don't know, people are just getting on his nerves today.
Oh, come on, let's get you.
Plus, Cobb was kind of getting on Katie's nerves, so, you know, Finn's really protective over us, so.
Hold on, brother, I'll take that too, bro.
Kind of pissed him off. So he went and slit somebody's tires, but he didn't get caught, so. Finn popped Cobb's tires.
Alright, brother, take a deep breath out.
Yeah, and that's what she does. When he started a fucking reality show.
Alright, there we go. Hold on.
Oh, and I don't know if Katie told you earlier, but
Take
she
a
got
drink of
taken
this.
hostage for a jewelry store. I was at Bean alone for a long time, and then Katie and Oscar showed up, and literally as soon as they showed up and sat down, two guys come in, have guns pulled on us, and well, Oscar said it sounded exactly like the person from last night. Yeah. You're gonna get out. I believe in you.
There we go.
How'd it go?
Not good.
Oh, that's I still can't move it.
Yeah. When I got in there and got to looking around, I could see that your spinal cord was blown out. A lot of swelling, and I started trying to draw off some of the fluid that was causing that swelling, and as I'm
I guess I knew it was coming.
Yeah. I even tried to place the electrodes that we had talked about to try to give us something to work with, but your body started rejecting them. To keep you alive, I went ahead and removed it.
Well, sounds like it would be good.
Yeah, but it doesn't make it any easier. But I've got a fusion completed, so your spinal column is now a solid piece around where it was fractured. But I've got a surgical mesh in place that is holding your spinal cord in place.
So it can heal, right?
The swelling will reduce, but the damage is too severe. Nerves don't regenerate.
So that's it then.
You'll spend the rest of your natural life in a wheelchair. I'm gonna believe that on the impact, that's what caused the blowout in the lower part of your spinal cord. Do you remember hitting your back on anything when you fell off the bike?
No, I went unconscious the second I fell off.
Damn. And there was soft tissue injury, but that'd be expected with any kind of trauma. But just the sheer damage to your spinal cord it's alarming. But I'm working on your surgical notes now and get those added into your file. But we'll get arrangements made so that way we can get you access to a wheelchair. Now it's probably going to take you a day or two before you'll have the strength to really want to be able to try to get down and into it.
Yeah, I feel a bit weak right now.
It's going to take you some time. I've got you on good pain medicine right now, and I'm going to keep you on it. Keep you on some IV fluids that'll help just kind of bolster your system. And because of the fact it was your spinal cord that's damaged, it's an area that's extremely high risk to some very nasty infections. So I'm going to give you some very high-powered antibiotics by your IV, and then I'm also, when we discharge you from the hospital, I'm going to send you home with some.
Alright. Yeah, you said a couple days.
Yeah, I would imagine it'll probably take at least a day or two to get your strength built up. I don't want you to rush it, because you gotta remember your back's fused now with titanium rods.
Well, at least I got a nice view to look at, I guess.
Yeah, definitely not the worst view in this place. But it was heartbreaking when I got in there.
Yeah, it is also confusing
You did what you could, though. Thank you.
Yeah, but I'll be honest, one problem I've always had being a doctor is when I can't fix something. Those are always the hardest.
Identical mask?
Well, it could have gone a lot worse, I guess. So at least I have some chance of getting back out there.
Yeah, there's definitely still a lot you can accomplish. certainly is a lot you can still accomplish. I just wish I could have done more.
I'm not really sure what to do with myself now.
What kind of work you normally do?
What's that?
What kind of work do you normally do?
I'm a trucker. I don't suppose I'll be doing that anytime soon.
Well, you would probably need to have a partner, but there are some really good modifications that can be done to vehicles nowadays, so you can still drive. But
I don't suppose old Dickie here could just handle the pedals.
Actually, they have some really cool controls, and you just move them from the floor up to your hand. Give you control over the brake and everything.
Oh my god. Doctor.
That might get a bit confusing with a clutch in the equation, but yeah.
True.
It's worth a shot.
Just switch to an automatic.
Yeah, but it's an 18-liter. It's supposed to be a
I'd
manual.
rather be a crippled Dickie. Oh wait.
My brother-in-law's got an automatic.
Is that the guy in the fruity coat?
No, that's my brother.
Oh, that's your real brother. Okay.
I will let you get some rest. If you...
I think I'm gonna catch some sleep here.
Oh, that's fine. You're welcome to stretch out there and get some rest. Yeah, if you start having any pain, anything like that, I've got orders at the nurse's station. They can give you medications.
Alright. Thank you.
They can page me if anything comes up, and I'll come back as quickly as possible.
Okay. Sounds good.
You guys get some rest, and I'll check on you tomorrow.
Did you need to check in with the nurse before you go?
Me,
I've got to go finish up some orders up, so I'll be at the nurse's station.
Lay down.
Because I think he got a little hungry.
Yeah.
I definitely know his pain. So, let me just give you a nice little booster here.
Yeah, I can't go in that room because of HIPAA, you know.
Normally I'd keep a few things stashed down at the nurse's station, but I hadn't had a chance to restock yet.
HIPAA violation? That's some serious shit.
There we go. Alright, boys. Y'all get some rest.
Never heard that a cop ever threatened me that before, and I've definitely verged in onto.
HIPAA's like.
All right.
Yes, ma'am.
For one, I apologize. My flight got delayed, so I did not fly out. But there was a situation at Bean, so I couldn't do anything anyways. But he's wondering if he can go out on the balcony.
I wouldn't have any issue with that as long as somebody was with him.
Okay. He's just wanting some fresh air, you know.
I understand.
Alrighty. Well, thank you. I'll let him know.
You're very welcome. Let me know if you have any trouble.
Alright, thanks. Come on. Do you know where the
Hello?
balcony is?
How we feeling?
Hey.
I
Newsom.
actually have to fly out, but I will be here to pick you up tomorrow.
Alrighty.
Bye, y'all.
Bye-bye.
Careful, ma'am. Have a good night.
You too.
All right. Hey,
Where's the balcony at?
It's
Feeling pretty good. It's I have my IV bag with me and that little like tiny.
Oh, you're good. Right this way. The balcony's on the next floor. Just right over here. Definitely ain't the fanciest, but you guys are welcome to sit out here. It's usually at least a decent breeze.
Yeah, for sure.
Y'all let me know if you need anything. I'll be down in the ER.
Will do. Thank you.
Okay, we'll do. I'll be back up soon. Don't worry.
Oh, you're good. Enjoy a little time outside while you got the strength for it.
Thank you.
Call me if you need me.
Yep.
All right. Thank God, it's been 11 o'clock. Jeez. Time flies when you're having fun.
that's done. Well, on that note, I think I am going to call it a night. I am rather tired, and holy cow, I've been at this for almost 3 hours. Good lord. Hey, Turbo. Sorry, brother. I have not been watching the chat. But yeah, old Shilan's back around enjoying the new hospital. It's quite nice. So, but anyway, I hope y'all enjoyed it tonight. Y'all be safe, and I will catch you on the next one.